We are going to treat each patient as an individual because that's what they are. We have individual treatment rooms. I've worked in offices where the treatment rooms are in an open bay kind of system, whether it be that they're just separated by cabinetry and the backs are open, but people can walk almost like between the walls. Sometimes it's more private than that. The walls do go all the way up to the ceiling in the operatories, but you can still walk in from behind, a rear delivery kind of entry. And as patients are walking by to go to their operatory or walking to the front to check out, you can see a little bit of what's happening in the room, which just isn't private. And we have healthcare privacy acts for a reason, that this is definitely dentistry. It's pretty invasive as far as we are intrusive into people's personal space. So we are working in a very vulnerable location. We're having you hold your mouth open where you don't feel like maybe you can communicate as well if something is bothering you. And we're like, oh, hold on just a second. We got to keep it dry, and then you can let us know. And keeping everything where every guest in the practice has their own suite, then things can be private. If a patient is fearful of the dentist and they want to tell us why that happened, then they don't have to worry about someone else being able to overhear in the operatory next door. If they have a traumatic experience that really kept them from coming to the dentist, they can let us know about that. And then there are just some health concerns that patients would not rather have publicized, so we can help walk them through that journey in order to better their health. So everything is just kept personal and private, in our rooms as well.